Hi, I'm Kristen Whitney with the University of Maryland Midtown campus. I'm here today with Dr. Onigbanjo, Assistant Professor of Medicine at the University of Maryland School of Medicine and Medical Director of the University of Maryland Pediatrics at Midtown. I know there's a lot of myths surrounding immunizations and vaccines, and I wanted to take some time with you today to bust some of those myths. So one of the myths that I hear sometimes is a vaccine can give a child the disease that it's supposed to help prevent. Is that true?
That is a myth per se. So most vaccines are actually created from killed particles of the vaccines, and in those cases, they don't cause the disease in which they're protecting against. There are vaccines that are made from what we call live attenuated viruses, meaning that they're very weak. They're supposed to stimulate the immune response to create antibodies to protect you against the disease. In someone who is healthy, it doesn't cause any symptoms. However, if you're immunocompromised, it's really important to talk to your doctor about these vaccines, whether or not it would be safe for you, given your medical history or your child's medical history. In most cases, however, viruses that are used to create vaccines do not cause disease.
Another myth that I've heard before is that my child does not need vaccines because no one really gets those diseases anymore.
That is a myth. So because of the development of vaccines, there are many diseases that we no longer see, some of which are eradicated, so we won't see them. Others are still floating out there in the world, and the reasons why kids don't get sick is because we're vaccinating against it. If you are unvaccinated, there's still a chance where you can develop diseases such as chickenpox, whooping cough. We recently had a measles outbreak, and these diseases are still present. I think because we vaccinate, we really decrease our rates of these diseases in the community, but it does not mean that your child is not susceptible.
Perfect. Thank you for clarifying on that one. How about this myth? Vaccines make kids sick.
Oh, vaccines make kids sick. It's something that we hear all the time, and families are always very worried that vaccines can make their child sick. So vaccines itself do not make kids sick. It may stimulate your immune response to make you not feel 100% of who you are. So you may be a little sore at the site, you may get redness or pain, you may have like a fatigue or a low-grade temperature, but those are actually all signs that the vaccine itself is working and your body is reacting to it and developing the antibodies needed to protect you. So when you are exposed to the disease itself, your body is ready and primed to protect you in a way that it's supposed to.
Great. The final myth I'm hoping you can help bust for us today is vaccines contain harmful levels of toxins. True or false?
So false. Every ingredient that is in a vaccine serves a purpose. And these ingredients have been shown and proven to be safe to be given and are actually part of the mechanism to keep vaccines stable so they don't break down. And once it enters you, it actually can work. There are things like preservatives that are really to keep it fresh and available to do what it's supposed to do. We do know that a lot of the ingredients that families are worried about have been studied and have been shown to be safe. So I do think that is a myth.
When a child gets vaccinated, what's the best time period to do that? Is back to school the best time period, or what would you recommend?
So the American Academy of Pediatrics and the CDC puts out routine schedules for when kids should get vaccinated. So we really do recommend following the schedule. There are vaccines from birth to adulthood. So there's a vaccine when your child's born, there's the vaccines at 2, 4, 6 months, 9, 15, and on and on. It's really important to work with your pediatrician to make sure they are up to date and getting the vaccines at the appropriate schedule for your child.
And does the University of Maryland Medical Center Midtown campus offer these immunizations?
Yes, we do. So in addition to routine pediatric care, We offer vaccines on schedule. We also offer catch-up vaccines for kids who are behind. And we also provide additional vaccines for kids who have special needs that need additional protection. So we do offer both well visits as well as an opportunity for kids to receive their vaccines.
Thank you again for being here today, Dr. Onigbanjo. And for our viewers, we hope that this answered some of your questions about vaccines and immunizations. If you have additional questions or concerns, or would like to learn more about the University of Maryland Midtown Campus Pediatric Services, please feel free to give us a call at 410-225-8780 to speak with provider. Thank you.